95.3 TBC International.
We are broadcasting live in Rahe in Tanzania. We're having a very special interview discussion, and today we are having a woman who is strongly committed to human rights, public health, and gender issues, which have an extensive experience in forging partnerships and consensus. And mostly what we have today is about women issues that are happening today all over the world.
95.3 FM.
When you look at how COVID-19 has affected the whole world, your organization known as Partnership for Maternal, Newborn and Child Health Organization, I understand it is one of the largest alliance for women, children and adolescents, and also when it comes to their health. So it basically brings together more than 1,000 partners. I would love to know, what is it doing to address the challenges that the women, children, and adolescents are facing?
So as the largest global alliance of more than 1,000 organizations working to improve and protect women's, children, and adolescent health, last year Pmnch issued a call to action on COVID, which builds on the needs identified by women, children, adolescents themselves, and urges governments to protect and promote the health and rights of women, children, and adolescents through strengthening political commitment, policies, and domestic resources, mobilization and financing supported by ODA, and also private sector alignment in financing. So this 24-month advocacy campaign seeks to rally leadership and partnership for concrete commitments, actions, and importantly, greater investments to address 7 priority areas to address needs of women, children, and adolescents. So far, countries and foundations have pledged $20 billion US dollars to invest in and develop policies to address the needs embodied by the call to action. So 36% of which have committed by low and middle income countries, include countries in Africa such as Kenya, Liberia, Nigeria. So our hope is that more countries, including many from the African continent, will follow the first adopters' lead and make commitments during the course of 2021. It's really important to kind of focus on, the areas that evidence has shown to really make an impact, to safeguard around women, children, and adolescents, because the return on investment is one of the best buys. It's really very high, and it's an economic case to be made to the Minister of Finance, and it's really one that enhances social development.
We have heard about what your organization is doing and what the African countries or countries all over the world should do to address these challenges that women are facing, and also the governments themselves. I would like us to look at the women in particular. What do you think is the role of the women in challenging inequality within the society?
So I think women need to be looked upon as partners. They're great partners if and when involved. We have seen that if you involve women, you really don't improve only her own health, but her family's health, and even her husband's. And so it's really kind of a cornerstone in community in involving women. And I'd like to share with you some of the results of, women leaders, like state leaders in the world, have actually those countries have done the best in the COVID response. And these are women leaders. And so I think it's really the same. To step up the fight, we need to involve women, empower them, make them a part of the solution, and really do this in partnership.
I would also like to know, I believe you have 30 years of public health experience. Paint a picture on how COVID-19 pandemic has affected the health, the well-being of these women and children.
So I think, in many ways, anywhere we look, women are the front lines of healthcare, both paid and unpaid in sub-Saharan Africa, 7 in 10 communities, healthcare workers, and a lot of the focus from research on, especially the lived experience that we have, there are several measures suggested by women and adolescents themselves that could work best for them, and that's important. So developing gender-sensitive and inclusive social protection and income support measures to reduce the vulnerability of daily wage earners, farmers, workers in informal sector, and those that living on the margins. These could include cash transfers, food stamps, small loans, vocational training, and skills development programs. So recognizing adolescent mothers as a vulnerable population and needing assistance from government support programs, spreading awareness of and providing information on the availability and benefits of economic support schemes throughout the population, engaging self-help groups and community organizations to identify vulnerable women, children, adolescents who should be prioritized to receive support, and then adopting tax and financial packages to stimulate small businesses, especially those run by women and young people. These are all important. These are proved success stories, that we need to make known and actually replicate in more, not only in more countries, but in more communities, more districts. These are some districts that have done this, good examples, and this could be replicated along. There is much really good evidence and good examples to share here.
Apart from doing all that, a country like Tanzania is one of these countries where women, children are still facing barriers and challenges like gender-based violence, female genital mutilation, and so many other challenges that women are facing. I'd love to know what is, as an organization known as Partnership for Maternal, Newborn and Child Health, what is it doing so far currently right here in Tanzania to address such challenges?
Right. So numerous media reports, anecdotal evidence, and administrative data have suggested that there has been an acceleration of domestic violence across the world as a result of the pandemic, especially increased, especially when lockdowns and restrictions on movement put families in close proximity of under stress for prolonged periods. So these increases in violence are occurring in the context of disrupted access to responsive services such as hotlines, crisis centers, shelters, legal and protective services, and also to sexual and reproductive health services, which often include screening components for violence. So COVID has also hindered efforts to end female genital mutilation, and UNFPA and partners anticipate a 1/3 reduction in progress towards ending FGM by 2030. So they estimate that disruptions, preventions efforts such as community empowerment programs and abandonment proclamations will lead globally to 2 million FGM cases over the next decade. So what are we doing? We are showing, we are calling out this. We are calling out this through our civil society, our women, adolescent, and partner organizations who participated in the live experience analytical work carried out the last year, offered up some clear solutions that leaders might adopt to tackle gender-based violence, including classifying prevention and redressing services that reach out to those facing violence and distress, and essential services ensure they remain fully functional. These services should form an integral part of COVID response plans. And then adhering to existing laws, governments, and calling out. So what we're doing is that we have increased our partner support to call this out and to really bring attention to that the COVID country responses have to explicitly, and please emphasize this, because they explicitly have to focus on women, marginalized, and it will be a silent wrong. It would be a silent wrong, and it will lead to detrimental results where women and girls are paying with their lives. So we are increasing media outreach on this. We are increasing citizen hearings. We are increasing, bringing this to the attention of the multi-stakeholder platform dialogue, and we are increasing parliamentary hearings to this to make this attention brought to this, so that it is in a time of crisis like COVID, that attention is focused on it, and that partners are coming together in order to make this not happen, because the consequences here are detrimental.
Once again, dear listener, if you've just tuned in, this is the International Drive program, and we are having a very special interview in commemoration of Women's Day. And right here we are having Mrs. Helga Fogstad, who is the Executive Director for the Partnership for Maternal, Newborn and Child Health. She is strongly committed when it comes to human rights, public health and gender issues, and she has got an extensive experience when it comes to forging partnerships and consensus building in order to promote the health and the well-being of women and children, and also not forgetting the adolescents. And once again, she is also a health economist with more than 30 years of public health experience. And we are having a very good conversation, informative and very productive. And as she is explaining to us what mainly her organization focuses on and done.
95.3 FM. 95.3 FM.
Mrs. Helga, apart from everything that is going on in our country and all over the world, especially now that we are battling COVID-19, what is your organization's response that ensures the health and the well-being of every woman, child, and adolescent here in Tanzania?
So Pmnch has issued a call for action on COVID, and very much look forward to engaging with the government of Tanzania to protect and promote health and well-being and rights of women, children, and adolescents through strengthened political commitment, policies, domestic resource mobilization, and financing. And in this call for action, there are 7 recommendations that cut across critical areas that are all very important. And what we are doing is to also encourage the use of evidence synthesis and other tools that Pmnch is preparing and making available to use in-country partners to support the effort and making difference for women, children, and adolescents. And I must just tell you, this is such a serious issue that governments are needed, and in partnership with all of the other stakeholders. So all of the other stakeholders include the bilateral partners, the multilateral partners, the private sector, the academic research teaching institutions. Everyone needs to be at the table, and not the least, most importantly, the NGOs, so that it becomes a partnership with women and girls in order to meet their needs and safeguard their health as well as their safety and well-being. And if that doesn't happen, it's going to be an invisible and really invisible tragedy.
Just one more last question. What is your special message to all women here in Tanzania who are listening to you?
Just know that all the women in the world stand with you in solidarity. Investigate your right. Understand what you need to do in order to how you can reach out if you need help, and if you need security. You need to be reaching out to neighbors, to services, in order to really understand not only how you can take care of yourself and your family, but care-seeking behavior, and also access the facilities and also the possibilities that are there. just try to understand that you are not alone, that you have partners around you, that understand how to better reach them in order to do this in partnership and in solidarity.
Well said. Thank you so much, Miss Helga. That's really very, very beautiful and inspiring message.
Well, thank you. Thank you so much. And have a good evening.
It's a new day.
95.3 TBC International. Executive Director of the Partnership for Maternal, Newborn and Child Health. That was Mrs. Helga Fogstad, calling in straight from Geneva, that is in Switzerland, whereby she was able to make an effort and make sure that she joins us in today's special interview production of International Women's Day. One thing about Mrs. Helga is she is a very strong, committed woman when it comes to the human rights, public health, gender issues, and also in extensive experience when it comes to forging partnerships that are mainly focusing on building, promoting the health and well-being of women, children, and also adolescents. She also has 30 years of public health experience, that is including many years that she has been doing when it comes to developing countries at the sub-national and national levels, and also as well as the global level within the multilateral and the bilateral agencies.
95.3 TBC International. The drive of your life. The International Drive with Rose Mirembe.
Everything you do in life, in order for it to succeed, you need a little bit of luck behind it.
Monday to Friday from 4 p.m.